Good morning, friends. Today we have discuss about the term keratoconus. So let's start. Kero means cornea, conus means concept. When the cornea is in concept, so that condition is called as keratoconus. So previously it is non-inflammatory, inflammatory. But in so many researches recently published, it also included inflammatory inflammatory. So it is always bilateral. Okay, it is actatic condition means thinning thinning of cornea. Okay, or it is slowly progressive. Suppose the cornea thickness is like this. Okay, center thickness of cornea is 0.52 and periphery 0.75. Okay, if lesser thicken. Okay, so this condition is known as keratoconus. So what symptom we see in a keratoconus patient? First, when patient is coming in our clinic, so patient say frequent glasses changes. Okay, so first is frequent frequent eyeglasses changes. Okay, and the second most is blurred vision. Yes, distortion is always there. Sometime halos. Okay, and in advanced cases photophobia is also there. Photophobia. So these are all sign of all symptoms of keratoconus patient. Okay, so what is the sign of keratoconus? Okay, so the sign is started when we examine the patient. Okay, so first is retinoscopic retinoscope. When we see the reflex of retinoscope, it is Caesar reflex. Okay, or maybe split reflex. Okay, so two condition is seen in the in retinoscope of keratoconus patient. Second is slit lamp examination. Slit lamp examination. So in slit lamp examination, we see first thinning thinning of the cornea, thinning of the mainly in stroma. Okay, in mainly in stroma layer. Second is Fleischer's ring. Fleischer's ring. So what is Fleischer's ring? Fleischer's ring is nothing. It is a iron deposition of the cornea. So when we see the cornea, Fleischer's ring is always seen in a cobalt blue filter. Okay, cobalt blue filter. Use cobalt blue filter when you see the Fleischer's ring. Okay. Second is Fleischer's ring. Third is Watt's strike. Watt's strike. Watt's strike is like this. It is seen in the descendant membrane. Okay, what is right? Or last one is opacity. Maybe opacity या फिर scar may be seen. Scar. If uh, keratoconus is very severe, so high drops is seen. Okay, so these all are internal examination. Okay, so what we see in a external examination, first sign is Munson sign. Okay, Munson sign. So in Munson sign, so when patient is look down, when the patient is look down, suppose this is eye, okay, when the patient is look down, okay, so is bulged, okay, bulge out the lower lid, so this condition is known as Munson sign. Second is Rizet sign. Rizet sign, okay. So these two condition are external examination, okay. So what we see in the by the help of instrument in keratometer we see high cylinder, okay, topography topography we see high cylinder, and last is pseudo-rings या pseudo-disc. अब what is pseudo-ring or pseudo-disc? Pseudo-ring is like it is very close like this, okay. This is very steeper condition, this is a steeper condition, okay. So keratoconus के sign and these are all symptoms of keratoconus patient. So the morphologically we divided the keratoconus into three shapes. First is nipple shape. First one is nipple cone, okay. So what is nipple cone? No, nipple cone is a small central cone, which is less than 5 mm on the curvature of cornea, okay. Second is oval cone. So oval cone is in oval shape centrally. The size is 5 to 6 mm, okay. So third is globus cone. So globus cone is whole cornea centrally, okay, means greater than 6 mm of cornea thinning. This shape is known as globus cone. There is some associated condition of keratoconus. Some are ocular conditions, some are systematic conditions. So in ocular condition, example like congenital cataract cause keratoconus, okay, or VKC. Nowadays VKC is a more associated ocular condition that lead to keratoconus, okay. Third is ectopia lens, okay, etc. These are all the condition which cause keratoconus, okay. Some systematic condition also cause keratoconus. First one is Marfan syndrome. Second is Down syndrome, okay, etc. These all are conditions which cause systematic keratoconus condition, okay. So what is the treatment we give to the patient? First line of treatment we give is spectacles, okay. If spectacle is not corrected the refractive error or condition, if patient is complaining or distortion vision in spectacle, so we go to the contact lens. Initially soft contact lens, then RGP contact lens, okay. In RGP, corneal GP lenses, or silicon GP lenses, okay. So our last one is PK, okay, penetrating keratoplasty, penetrating kerato keratoplasty. So in PK, kero means cornea, plasty means change, means we change the cornea, okay. The second condition is keratoglobus. Keratoglobus is simply, it is also a bilateral condition, bilaterally condition, congenital condition, okay, or it is also a thinning, okay, or protrusion of cornea, protrusion of cornea. Okay. So what is the difference between the keratoglobus and keratoglobus? Keratoconus and keratoglobus. The main difference is in keratoglobus, the whole cornea is thinned out. Okay. The entire cornea is protrusion. Okay. In keratoconus, there is only a central thinning, central shape. Okay. But in keratoglobus, the whole entire cornea is protrude. Okay. Or it is also non-progressive. It is non-progressive. Okay. There is also a condition like we can say differential diagnosis. Differential diagnosis. Congenital Bruptophthalmus. So in Bruptophthalmus, due to the pressure, the cornea is moved forward. So in this condition, corneas look like a keratoglobus, but the condition is not keratoglobus. Okay. So differential diagnosis is congenital Bruptophthalmus. Okay. So the line of treatment is same. First, spectacle treatment. Second, contact lens. Or third line of treatment is PK. Okay. So these are all the treatment of keratoglobus. Thank you.